All right, so today we're going to look at the management of a woman who is in her first stage of labor. So today's question, we saw that students were being asked to manage a patient, or rather a woman who is in a second stage labor. So these are the commonly asked questions when it comes to maternal and child health. So we can remove that one because it has already been examined and, well, chances are that it can be brought back, but they are very slim. So there's just a few points that I want to mention, especially when you're managing a woman who is in a first stage of labor. So we know that first stage of labor, this is from commencement of true signs of labor up to the time that the cervix is fully dilated. So during that time, there are certain things that we need to do for this woman. So first things first, we must start with aims, or what you can call objectives. So number one, you can look at monitoring the progress of labor. So monitor the progress of labor. At the same time, you are trying to prevent any complications that may arise. So to prevent complications, like I was saying, always give at least one or two complications that may arise. So it's not enough just to say prevent complications. Then eventually you want to deliver the baby safely. So you want to promote or ensure safe delivery of the baby. And safety, we mean prevention of injury. So among the complications, babies may develop birth injuries, cephalohematomas, nerve injuries, so many complications may arise, asphyxia, and so on. So when you're preventing or ensuring safe delivery of the baby, you are reducing those complications. So it's not just physical, but also otherwise. You want to prevent infection, so therefore, all your interventions, especially invasive ones, make sure that you adhere to strict aseptic techniques. So I was saying 3 objectives are enough. Don't exceed that. This is an exam, so you're rushing against time. So first things you do is to manage your environment. So next subheading is environment. What are the main issues here? Of course, we know that environment has to be clean to prevent infection. Environment must be private. So privacy is important. Ensure privacy at all times. Okay, because these are patients in their vulnerable state. So clean environment, maintain privacy, must be well ventilated with proper lighting. So there's the next point is lighting that is proper for easier observation. Environment must be quiet with all the necessary and resuscitative equipment readily available. So equipment, then environment must be safe. So hazards, we may never know what can happen this morning labor. So all potential hazards, floors that are slippery. So this also protects you as a caregiver. So make sure such, blood products, fluids that have spilled on the floor are quickly mopped out. Potential electric cables that are exposed, all those things must be taken care of. Sharp instruments, make sure that they are managed properly. So that's your environment. You are ready to have this baby receive. So resuscitator should be there, emergency trolley, incubator nearby to respond to all those emergencies. Penguin sucker, suctioning, and oxygen cylinders or ambibag nearby. Next is you want to offer psychological care to this woman. So remember, they are still in their first stage of labor, point where we are heading towards full dilatation of the cervix. Under psychological care, what are the most important things? First of all, explain the process of labor. So, of course, the contractions are painful, yes, but the woman can understand your instructions and explanation. So explain the process of labor so that the woman understands. At this stage, you don't want her to be pushing, and that may cause tears and other complications that may interfere with the progression of labor. So this patient may have a companion, so you may need to allow either herself or the next of kin to ask questions. So give room for the patient to ask questions and offer clarifications where necessary. So you must respond and give room for them to understand what you have tried to explain. Let the patient and the caregivers air out their concern, because there are so many misconceptions about labor, especially in the setup that we live in. So many beliefs and myths associated with labor. Then explain all procedures that you're going to do on the patient so that the patient can approve and have awareness of what is about to come. So you may do certain invasive procedures. Okay, you're going to draw blood, you catheterize the patient, you're going to be doing vaginal examinations, you're monitoring the heart rate, and so on. So patient must be aware of all those interventions. Mainly is for cooperation and for patient to have prior knowledge before you do, for cooperation and consent. That's the main idea. Next is ensure privacy and confidentiality. So you're going to explain that whatever information you're going to obtain will not be shared with anyone else, and you make sure that the room or the environment, the delivery room, is free from passerbys. So not anyone can walk in unless authorized personnel. Maybe even a partner, if at all they are willing to be part of the labor process. Okay. Then explain to the woman what they will be expecting in the first stage, and maybe even prepare them for the second stage of labor, when the contractions begin to be so consistent, frequent, and stronger than in the first stage. So patient should anticipate. Of course, it's going to cause some serious pain, and prepare the patient psychologically for that. So those are the points under psychological care. Explain the whole process, give room for the patient to ask questions and express their fears, concerns, misconceptions, myths, and so on and so forth. Then procedures to be done. Explain so that there's cooperation and patient gains knowledge and then gives consent to those procedures. It's in the best interest that they give consent for themselves and the well-being of the baby. Then privacy at all times, confidentiality, and prepare the patient for what will happen during the first stage and potentially what to expect in the second stage. Okay, next we can look at position. So positioning, what is your recommendation? So mainly we say left lateral is recommended, but you find that that may be difficult for the patient because of the pain. They may be fidgeting here and there, but encourage the patient to walk around, as that may quicken the labor process. So mobility is encouraged. Don't just let the woman sit and wait for her to deliver. That's why you see midwives to be a bit, firm, because they understand what is at stake. So encourage the woman to walk around. So mobility should be encouraged. The rationale is just to promote or quicken the process of uh, labor. Okay. Next is observations. Very important. So, excuse me. So under observations, make sure you use a pantograph. So this is a tool that is used to monitor progression of labor. So under this, what are we doing? So first of all, is fetal well-being. Under observations, you're observing for fetal well-being. So that is more like A, under observations, using a pantograph. So you open the pantograph. First thing you're doing is monitoring the heart rate. So fetal heart rate is being monitored. So you're expecting in the ranges of 110 beats, somewhere to 160, 170. So above that, above 180, below 110. So below is bradycardia, above is tachycardia. So either way, that is not a good prognosis for the baby. Okay, it can be a sign of distress, sign of asphyxiation, and you may need to consider other options. So monitor fetal heart rate every half hourly, so 30 minutes apart, and then keep reducing as labor progresses. Next is under observation, monitor molding. Molding, we are saying these are sutures, and whether there's excessive molding or moderate. So that can be an indication of potential injury to the brain. So you do that under vaginal examination. So monitor this 4-hourly, of course, under aseptic technique. So 4-hourly monitoring of molding. So see that the sutures are not extensively overlapping each other, as that may cause brain damage. Now, baby comes with complications like cerebral palsy, so you don't want to deliver such a baby under your care. Next is monitor the color and amount of liquor. Okay. So that can be the main rationale. You want to detect if there's any fetal distress. So this is a fluid from the birth canal. Once the membranes rupture, and then amniotic fluid comes out and so on. So you must monitor. So fetus may pass, fecal matter, and that distorts the color of, liquor. So we want to detect if there's any fetal distress and put up intervention quickly before any complications may arise. Next is monitor progression of labor. So that is fetal well-being. Next is progression of labor as a subheading. Progression of labor. So here you are mainly concentrating on contractions. Excuse me. Again, half hourly, so 30 minutes apart. You are monitoring the strength, the duration. So you're looking at that. How frequent are they? And how long are they taking for one contraction to elapse? So you monitor that using a pantograph. You keep plotting 30 hourly. Next is descent of the fetal head. So descent, at which level or station is the fetal head at? Okay, so you know the divisions of the true pelvis. You have the inlet, cavity, and so on. So monitor that. Again, this you are doing it 4 hourly apart. Okay, to monitor the progress of labor. So should be changing and going towards the engagement of the fetal head in the pelvis. So you find that the baby is stationed, there's no progression. Check again 4 hours later, no progression. Then it could be that there's a disproportionate and you may need to consider cesarean section, because no matter what, that baby may not be delivered. Equally monitor cervical dilatation as you monitors fetal head descent. So you're doing this together. So this is 4 hourly as well. So how many centimeters of dilatation are you looking at? Okay, is it 2 centimeters, 4 centimeters? You keep noting that. Okay. Next is maternal well-being. So away from progression of labor, monitor maternal well-being, because you're dealing with two clients here. So when you're done with the fetus, also look at the mother herself. So under maternal well-being, what are the most important things here? So temperature, monitor temperature, those are vital signs. Now, temperature can be a guide for possible infection. Monitor blood pressure. So bleeding, blood pressure may be affected. So pulse, blood pressure may drop or blood pressure may increase. So monitor that 2 hourly. Temperature, pulse, monitor 2 hourly. Same with pulse and respirations. Pulse and respiration equally monitored 2 hourly. Then do urinalysis. So urinalysis is very cardinal here. So most importantly there, you're looking at presence of sugar. Of course, there might be trace amounts because this woman is pregnant, so glomerular filtration may be impaired slightly. Acetone and proteins. So that's why you need to catheterize so that you can collect a sample and quickly do a urinalysis. Okay, because patient may develop complications like eclampsia and so on. So monitor sugar, acetone, and proteins during urinalysis to rule out complications. Other things that you're doing while managing this patient is hygiene. So the hygiene, so your environment matters. So there will be spillage, there will be body fluids, blood and blood products. So make sure that your floors are clean and dry to avoid any falls or accidents. Then Linen must be clean as well and dry. You don't want infections, maybe to the mother or even the baby, so you're preventing infection and just for comfort, You don't want to keep this woman on sewed linen for too long. Okay, but we know in practice some of these things may not be available, and most of the times women are asked to come with their own uh, linen. So, but we are managing ideally. What's the ideal case? This is what we need to do. So, clean and dry linen to prevent infection and promote comfort. So, any spillages and so on must be cleaned immediately. Okay. So, personal hygiene is also important. So, this could have been done way, way, way early. Okay, but so personal hygiene or cleansing. So we're talking about having a bath, shaving, private area. That could have been given to the woman much, much early. Okay. You know, oral care, hair care, all those must be encouraged or do for the patient in case that they can't do it on their own. But in this case, just encourage the patient to do oral care, hair care, and bath prior to admission during labor. Next, we said shaving, but also perineal hygiene is very important. So perineal hygiene, prevent infection